Welcome to HealthSmart. What is HealthSmart? It is about keeping the patient records in an organized and orderly manner, including patient medical history, inpatient hospitalization, discharge, and billing details. It integrates processes and interactions between patients, doctors, hospitals, laboratories, and pharmacies. Hospital operations, with back-end processes, is also integrated, including accounting, purchasing, and inventory. Join us today in discussing the details of HealthSmart. First, when we navigate to Overview, it will bring us to the dashboard. It is totally customizable, where you can edit it according to your needs and what we want to show in our dashboard. Next, we have the Patients menu, where it shows the list of existing patients at the hospital. Under this menu, we have Alpha List, which shows the alphabetical order of the patients, as well as the patient ID, where the list is arranged by their ID number. We can also see the Primary Care Doctor menu, which shows the number of patients who have visited the said doctor. So, if you click the name of the doctor, we can see all the patients that have consulted them. Now, if you click a patient name, we will be directed to the patient's details. Here, patient's information can be edited. We can enter the patient details here, like their date of birth and other demographics. We can also input the patient's primary care doctor here. In this section, we can see the outpatient and inpatient history when they get admitted in the hospital. Under Outpatient tab, it will show the consultation date, the physician they have visited, and from which department. Under Inpatient tab, we can also see the details of their admission. When you click one item of the patient's visit, we can see the OPD history of the patient and from that date. Under Health History tab, doctor can edit and enter here the presenting complaints or symptoms of the patient, vital signs, and other relevant details. Next, we go to Appointment menu. It can also be viewed by calendar, by department, by physician, or by patient list view. In calendar view, the schedule of the doctor or the name of the patients who's under them will be shown on which day they want to consult the doctor. We can see weekly or monthly view schedule. All of these doctors have the following schedule or appointment of patients on this day. We can also filter the doctors, so that way their patients are only shown for that schedule. Next, under Inpatient Administration, we can enter all the details here while the patient is hospitalized. We can also see the list of the patients who got admitted. The common details of the patient will be shown on the first section, and on the lower section we can see Care Plan tab, where the doctor and nurses can input the plan of care for the patient during hospitalization. On the next tab, we can enter the details of all the charges we have rendered to the patient, like the room charges, doctor's visit, nursing, laboratory, and other investigation, and items that we have used. Also, under Inpatient Administration, is the wardroom. We can see the list of rooms which are available or currently occupied. Other ways of viewing it is also available, and it will show the same information. Next, under Investigation menu, we have our Diagnostic module, where doctors can request laboratory, as well as radiology, and other investigations and laboratory reports. The laboratory technician can enter the result of the diagnostic investigations. They can either send it by email to the patient, or give a printout of the laboratory result. Investigation images may also be attached, such as ECG and X-ray images. Next menu is the Pharmacy. Here the doctor can enter the prescribed medicine that the patient needs. Same as the investigation reports, we can send the prescription via email or print it. On the Reporting menu, there are analytical data that shows graphical information of patients' demography, cases, doctors, among others. This can help hospital on generating statistical report every month or annually. The reporting module is also customizable. It has various views like tables, chart, and other graphs, depending on the needs of your annual reporting. Next on our menu is the configuration, where the hospital administration can edit and add all their pertinent details from their initial setup. Now, we can go to Billing and Accounting. In Billing and Accounting module, all the consultation, admission, investigation, and prescription invoices can be generated in Accounting module. Here is an example. We can create an invoice from the laboratory investigations itself, as well as in the patient hospitalization. Once the patient gets discharged, we can create invoice from here as well. Same goes to appointment, consultation, and giving prescription to the patient. All of these modules are integrated into the Accounting module. It is also its own dashboard that shows paid and unpaid invoices that needs to be validated, bank details, and other transactions. From here, we can register patient's payment and generate a printout of the invoice. We can also see here other important features of accounting, like management of budget among others. Additionally, it can generate a variety of reports and financial statements, including profit and loss statements and balance sheets. Furthermore, it has the inventory module that will help us in management and control of our inventories. All the products and items that are available in the facility can be recorded here, like all consumable items, drugs and medicines, and all equipment and supplies that are currently available. And whenever an item is used and have been entered in the patient's file, the quantity of the used item will be updated automatically. Lastly, we have the Purchase module, where we can create a purchase requisition, request for quotation, and a purchase order. From here we can also accept and receive the ordered items, as well as send invoice to vendors. That's the end of our demo. Thank you. And once again, welcome to HealthSmart.